Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with another podcast of the Common Sense MD. I have a familiar face here, Dr. Susan Creech, who's been so helpful to me in discussing oral health. I mean, and she's really not your typical dentist. She's really a step above and a step ahead of everybody that I've spoken to. So it's good to have you here again. There's a controversial subject that I want us to kind of chow down on and really hammer out because it's controversial. But before we do that, that's root canals. We're going to talk about root canals, the good, the bad, and the ugly. But before we talk about that, we were just sitting here discussing something I think is important. I was talking to you about getting my teeth cleaned twice a year, and you told me I should really be doing it 4 times a year, which you convinced me, and I'm going to. I'm going to get it done 4 times a year. But he also asked me, do I have my teeth probed? And I've never heard of that. So tell me a little bit about teeth probing before we get into root canals.
Most people would recognize probing when a dental hygienist puts a probe between the gums and the tooth very gently, and they read off numbers. So you might hear 3, 2, 1, 2, 2, 2. And there's 6 points on every tooth that should be probed. And what you're testing for is to test for bone loss and for inflammation.
Interesting. And that should be done
once a year.
Once a year.
Mm-hmm.
Okay.
Now, the American Periodontal Association, that is their standard and recommendation once a year. Now, if someone has periodontal disease, you might do it more often because if you have periodontal treatment, then you always want to reprobe and make sure that the tissue is tightened and that there is less inflammation or no bleeding at all.
I wasn't aware of that. Maybe they do it and I just didn't realize it. But so if somebody's not sure, should they ask their dental hygienist, are you probing my teeth?
Absolutely.
Okay.
And it goes back to, once again, letting your patient get involved with the findings and the treatment and making sure they're involved in the appointment so they know what you're doing.
Yeah, I love what you're saying here. Let's talk about root canals a little bit because it's a really controversial subject. A lot of my patients just refuse to get a root canal for some reason. I guess they're worried about later infections. And then, I guess when you do a root canal, you're actually or making a tooth dead, right? Because you're taking all the nerve and I get maybe the blood supply. I don't know. But let's talk about root canals a little bit.
Okay, well, let's define what a root canal is first. A root canal is a dental procedure that removes the pulp that's infected from the tooth, and it seals the canal with a filling. Okay, and then after you have a root canal, you typically get a crown put on the root canal over top of the tooth so that it is more stable. Because you don't want to have a weakened tooth and you bite down and the tooth breaks.
Okay. So a root canal is trying to maybe save your tooth instead of having to get an implant? Is that what you're saying?
Yes, so you can save a tooth and not have to have it extracted. Because once you extract a tooth, if you don't replace it, then the tooth above it or below it is not going to have a partner to bite down against. And also, if you have a space, then teeth are going to begin shifting, and that can affect your bite and the way you function.
A lot of dentistry is about spacing, isn't it?
It is. Spacing, function, alignment.
And then infection.
And infection.
Like we talked about before with the testing that you do for various types of bacteria and viruses. So root canals, why are they so controversial?
I think that root canals are controversial because of some earlier research that was done even back into the 1920s. So in the 1920s, there was a researcher that claimed that the bacteria out of a root canal would leak out into the bone and cause illnesses.
Okay.
Yeah. And, and then even more recently, there was a film on Netflix, and it was called Root Cause, I believe. Root Cause. It had some of the same claims, but most of the claims were from 1920s research.
Interesting.
And I've always said, like, whatever side of the fence you're sitting on with this, you can find information that will support your belief, you know.
Yep.
But but the movie Root Cause was actually taken down because they just found no merit to many of the claims that they were making. And the American Dental Association got involved and they spoke out. They stated the claims in this movie have been disproven by decades of peer-reviewed scientific evidence, and that it may actually cause people not to seek the care that is necessary.
And they do, excuse me, they do need the care. Now, so tell me about a root canal. Say you did have that, you needed that. What kind of care should you give? It goes back to the rinses, the probiotics, and all that. Tell me about that.
So if you do need a root canal, is that what you're asking? If you need
Yeah,
need
if
a
you
root
need
canal,
it or worried about them, if you have more than one.
Yeah, if you have a root canal on a tooth, then you just need to make sure that it's protected with a crown. And then you clean it like any other tooth. You still need to floss. You still need to use rinse. Still need to get professional cleanings so that the area stays free of the plaque that can still get around a crown and a tooth that's had a root canal. You know, the tooth is going to be a dead tooth. You won't have feeling from cold or heat with it, but you'll still be able to chew and function with a tooth that's had a root canal. And getting it x-rayed periodically is important too, because you want to have a dentist checking to be sure that the bone level remains around the root where you've had the root canal. Because oftentimes when you've had a root canal, you probably already have a little bone loss to begin with.
What kind of patient really gets recurrent root canals?
Patients that have had injuries in the past. You know, I have patients that have been in car wrecks and, you know, one after another tooth, they will end up having root canals. Patients with extensive dental work, deep fillings when they were younger. Even a deep filling can be done, you know, last week, and then a week later they have sensitivity because the pulp gets really angry. You know, the pulp becomes inflamed. And you do give it a little time to see if the pulp settles down. And if it doesn't, then, you know, a root canal might be the direction that you'd have to go in.
So if you have to have a root canal, rather than pull your tooth, any tips on how to, number one, prevent having root canals? And two, if you have to have one, how do you treat it? Like these rinses that you have? With...
So if you have to have a root canal, then you just have to have a root canal. You know,
Right.
I mean,
Okay.
the tooth is not going to revert back to health.
Yep.
So your options are going to either be have the root canal or get the tooth out or suffer in pain. But oftentimes a tooth that you might be told needs a root canal can be completely asymptomatic.
Right. I've heard of those.
And, you know, and those are times where you and your provider just have to decide, is this something that I'm okay waiting and watching? Am I okay getting an x-ray every couple of months, see if there's been any changes on the x-ray? You know, you certainly don't want an infection to stay in the bone, because at some point it's not going to just stay in the bone. You know, it's going to end up in the rest of your system and can even develop a little hole through the bone and start draining out. So you can push on tissue around the teeth sometimes and pus will come out.
Wow. That's
And
scary.
you think you're swallowing that, you know,
that is scary.
and you don't even know it because you're not tasting it, you're not feeling it.
So if you were a patient and you were told you needed a root canal, you had no symptoms at all, could you safely follow that with serial x-rays? Is it like urgent that you get a root canal right then, or could you follow it?
Most root canals are not going to be emergency situations unless you have extraoral swelling.
Okay.
Or even intraoral swelling. But, you know, you have probably heard stories of people who get bad infections in their mouth and the infection goes and abscesses to the brain and you die.
Yeah.
I mean, there are stories that
Or to your
happens.
Heart. Yeah.
Or to
or
your
you
heart.
get septic. I've had patients get septic.
Yeah, you were
from
telling
their
me
teeth.
about someone that was in the hospital
Yeah,
for that.
yeah.
So, you know, you need to find a provider that you trust. And in my practice with root canals, because of how much the technology has evolved with root canals, I send most of my patients to an endodontist who is a specialist in root canals. And we're very fortunate in the Tri-Cities area because we have fantastic endodontists.
We do.
They're quick. They do painless root canals. They use top of the line materials and technology. They're using surgical microscopes and CBCT imaging. And so, you know, we trust our endodontists in this area. But that's what I would say to a patient. And if you've been told you need a root canal, just make sure you're trusting the provider that's going to be giving that treatment to you.
Makes total sense. The old statement goes, I'd rather get a root canal than do that, so it has that connotation as being very painful and something you really don't want to do unless you have to. But today, it's much easier, I understand.
Right. And the actual procedure, the root canal procedure. Now, I have not had a root canal myself, so I'm not speaking from personal experience on this, but I have thousands of patients that tell me about their root canal experiences. The procedure is not painful. Mm-hmm. The leading up to getting the root canal, because the pulp has inflamed, the pulp has died, there's a swelling, there's pain, there's throbbing. I can't sleep when it lays, when I lay down, it throbs. That is what people refer to as a root canal being painful.
Interesting. So it's not the procedure itself.
Right.
So you don't think it's...
Most of the time. I mean, there are exceptions because if oftentimes when an infection is quite large, you don't get anesthetized as well.
Yep. Understand.
Because the anesthesia just can't get to the tooth.
So this infection or abscess is usually below the tooth, and it's destroying the pulp.
Yes.
And have you ever seen a person turn that around with antibiotics or anything else that kind of clear it up without getting a root canal? Have you seen that happen?
I have seen where I put patients on antibiotics for a tooth that appears to be abscessed on the x-ray, and yes, it has resolved. But typically, if it is a true abscess that is affecting the pulp of the tooth, it's going to come back. The antibiotic is going to, keep the pain down, keep the swelling down, keep the symptoms down, but typically it will come back if it's a tooth that truly needs a root canal.
That reminds me of something I've been studying and talking about recently is appendicitis. Mm-hmm. And the thing is, the new thinking is really you can treat appendicitis without taking your appendix out. Now, my dad and my brother, who are both surgeons, would probably disagree with that because of cognitive dissonance. Mm-hmm. But if you look at the literature, and I actually had a patient who did this recently, actually son of a physician who was in another town, and they elected not to take the appendix out because it was early. Mm-hmm. And, the antibiotics worked.
Really?
He did not end up having to take the appendix out.
So what happens if the appendix ruptures? Is that a different story?
That's a different story. It's only if you treat it early. Okay. But if you ever read Dr. Marty McCary's research out of Hopkins, he's a general surgeon. Matter of fact, he's going in on this new administration. And he's a researcher. He's a, just flawless type of guy. If there is a flawless surgeon or researcher, he's well published. And if you read his new book, he talks about this very thing, how as a general surgeon, they came up with this thing that you could treat appendicitis with oral antibiotics, and 50% of the time it's just as good as taking the appendix out. So I don't know why I'm talking about that, but it just reminded me of that. So maybe the root canal has a similar thing where if you got it early, you maybe could treat it before you had to do that. Because you're still going to have a dead tooth. And in the long run, will that tooth last as long as a normal tooth? Because you're putting a crown on it. Will it do just the same as a normal, or maybe better? I don't know.
The tooth will likely last as long as a normal tooth. You may have to have a crown replaced over your lifetime, but keeping the tooth where it was to begin with and keeping it in function is going to be what's going to help keep the tooth
be the same.
Mm-hmm.
I've had to have very little dental work, knock on wood, but I did have to have a crown, and I was real worried about it, and it was nothing. I mean, that was an easy procedure.
Right.
They did it right the same day. They did, they made the crown and all. It was just really easier than I thought it would be. Do you end up doing a lot of crowns?
I do. Dentistry's come a long way. Yes.
It's not to be feared. Like when I was a little kid, I hated to go to the dentist.
Right. I hear that all the time, and many times it's because they weren't numbed, or you hear the story that the dentist was, had their knee in my chest pulling a tooth, and I've never seen that, never done that, but but I've heard that many times.
I think the techniques for numbing are so much better. You don't even feel it now, do you?
No, you don't.
That's just incredible.
Just gentle technique, and there's a topical anesthetic with benzocaine that's
Do you use
usually
that?
rubbed on the gums.
And do you rub it to distract the patient?
Yes.
And then
Mhm.
that's what I noticed they did to me when they had the crown. I didn't feel it.
I actually use a little facial buzzer. It buzzes on your cheek, and my dental assistant will just hold it on the side of the cheek where I'm numbing, and the patients are more concerned about why they're feeling the buzzing on their cheek than they are a pinch of a needle, because they always ask, why did you do that?
That's a great distraction. The pathways to pain.
Yes.
So, root canals, that's one reason why you are a preventive dentist. You do all this stuff with salivary testing, and you try to prevent people from having to have a root canal or cavity or periodontal disease. We talked about, when you're doing a great dental exam, which you do, you've checked me, and looking for other things that you want to call to attention of that patient.
Mm-hmm.
So if they're here for just a cleaning or something, you go the extra mile for them, which I like, and you're honest with the patient.
Mm-hmm.
Hey, we're going to give you this cleaning, but you have gum disease, or you have this problem that you need to address. I think that's so important that you practice that way. And it's harder because it takes more time, and
It does.
leads to other things that they may need to start doing. But you're saving their teeth is what you're doing, and probably saving their life in a lot of ways, because infection.
Right. And I feel like, with my dental hygienist, I have to give them more time for appointments so that they can follow through with these more comprehensive tests that we want to provide for our patients. So, in my practice, I've had to rearrange some scheduling and rearrange how we practice in order to make it very patient-centered.
That's because you do it the right way. Now, how long does your hygienist usually spend with a patient?
An hour and 20 minutes.
Wow. That is a good long
Right.
time. So, Dr. Susan Creech, thank you so much for talking about root canals, a controversial subject, and all this great stuff you do. I just love what you do.
Thank you.
Congratulations.
Thank you for having me.
Keep it up.
Yeah.
You're going to be doing this for
Thanks.
many, many years.
I hope so.
So we'll have you on again for any topic that you want to talk about. We'll have you. Anything new, which I'm sure there will be, we'll sit down and talk about it.
Okay. All right. Thank you.
Thank you. We'll see you guys next week.